The uniqueness of the intensive care setting in terms of patient-centred communication is that very often the patient is either too confused or unconscious, so that you're actually unable to have the conversation directly with the patient. As a result, you end up speaking to family and friends who are important to the patient. This means that you may have multiple meetings to allow them to understand what the picture actually looks like, and that can be very challenging. Sometimes they won't have heard, or at least have not taken in the full picture. So during that process, it's essential that you sit in a quiet room, undisturbed by others, and that you give time for the family to describe the story as to how they understand it. And then allow a picture drawn by the doctor or whoever is talking to the family about what the picture really does look like. And all the time feeding back the vibes coming from the family as to whether they're really understanding the story or not. Having described the story, you allow time for them for the message to sink in. And if they have questions, then of course they can ask questions. But it is essential to map out with clear terms as to the picture described, where you believe the way forward should be, but obviously always seeking input from the patient's family and seeing if they are starting to feel comfortable in the direction that you feel is important for the patient. And then depending on the stage where they're at, you then can start to make very clear plans as to what should be the next step in the journey, and particularly if it's going through a withdrawal or withhold of active treatment, which in the end will result in the patient dying. It's always important to stress that the patient dying will be comfortable and not distressed or in pain, and to give that reassurance to the family and indeed how that might occur. And so it's essential to be very clear about the next steps forward, and indeed ask them to really reiterate or repeat the plan so that you get a really good picture of what's actually happening. Another important component is taking, say, the bedside nurse with you, so that you've actually got someone else listening to the story, so that when they go back to the bedside with the family, that in fact they offer opportunities to clarify anything that they didn't understand through that whole communication process. But it can be a very long meeting, but it's important to get the right message through so that everyone feels comfortable that you're actually doing the right thing.